one of the new vaccines is HPV vaccination. I think there are several issues that really make HPV vaccination very unique. The first and I think most obvious thing is that the vaccine is targeting a sexually transmitted infection. HPV is the most common sexually transmitted infection worldwide. And we now know that it causes nearly all cervical cancers, as well as a large number of vaginal, vulvar, penile, anal, and oropharyngeal cancers, which are actually on the rise. So this vaccine is actually trying to protect against cancer. And I think when they first came out on the market, nobody knew what HPV was, and and even less people knew the causal link to cancer. So the vaccine really caught on as an STD vaccine, which automatically makes the subject a little more touchy, a little bit more controversial. I think over the past couple of years, there's really been an effort with communication and education, a turning of the tides to raise awareness that this is really an anti-cancer vaccine. The second thing I wanted to mention was actually the timing of vaccination, which makes HPV vaccination special. This is a vaccine that is targeted primarily to young adolescents, so ages 11 and 12, and as early as age 9. And this is a time where health services are not being administered as routinely. This vaccine requires 3 doses over a 6-month period. So we're really, placing a burden on parents and the vaccine recipients themselves to come back to the health clinic for multiple visits at a time when they wouldn't otherwise be intersecting with the healthcare system. So I think in talking about how to increase the rates of HPV vaccination and other vaccines, we'll really need to figure out how to overcome these logistical challenges to make the vaccines more accessible. And the last thing I wanted to mention was actually the timing of the disease relative to vaccination. So for a lot of the childhood vaccines, we're really addressing diseases that have a very imminent, very visible threat. But with HPV vaccination, we're talking about preventing cancers that otherwise wouldn't present themselves for another 20 or 30 years. So I do think that there is some kind of discounting of health benefits that we attribute to HPV vaccination compared to these other childhood vaccines. And in a similar way, with respect to the other the vaccine preventable diseases, with cervical cancer, which is the most strongly linked to HPV, we've also been the victim of our own success in that we've had pap smear screening programs for decades that have dramatically reduced the incidence and burden of cervical cancer. And so the need for HPV vaccination may not feel as urgent. But I think it's critical to remember that for these other HPV-related cancers, there really is no other prevention mechanism. There are no screening programs. And so the HPV vaccines really remain the best defense against them.